Hello and welcome to my presentation on the case study that I published in the Journal of Metabolic Health recently. The article was entitled "The Ketogenic Diet and Metabolic Syndrome in Parkinson's Disease: Symptoms, Biomarkers, Depression, and Anxiety, a Case Study." Thank you for stopping by my research poster at the SMHP Metabolic Summit in August 2024 in San Diego. The use of therapeutic carbohydrate reduction in the form of a ketogenic diet in neurodegenerative disorders like Parkinson's disease is increasing as an adjunctive treatment to primary and secondary symptom mitigation. We know that Parkinson's disease has some primary symptoms that are very common. These include motor deficits, rigidity, tremor, but we also know that Parkinson's has associated comorbid symptoms, such as, in many cases, depression and anxiety, that has a lot to do with the differences and issues with dopamine production in the brain. There exists a gap in the literature on the symptoms of Parkinson's in the setting of metabolic syndrome. It's possible that metabolic syndrome has some comorbid impact on the symptoms of Parkinson's disease. We know that it has impact on the biomarkers of health, cardiac risk, and can often be implicated in symptoms of depression and anxiety. This case study documents a 24-week ketogenic intervention for a 53-year-old man with multiple comorbid diagnoses. He had a Hone and Yahr Stage 2A score on his Parkinson's diagnosis. He also was morbidly obese, class 3, with increased waist circumference, prediabetes, hyperinsulinemia, significantly impaired mobility. At baseline, this individual could only walk about 10 feet to his bathroom with a front-wheeled walker. He spent most of his day in bed. He had chronic back pain with his pain rating scale of 8 to 10 out of 10 most days and was on 3 pain medications. He also had a diagnosed depression disorder and was on medication for his depression, and an anxiety disorder and was on medication for his anxiety disorder. So you can see that this individual had multiple comorbidities. I assessed this individual at baseline, at 12 weeks, and at 24 weeks. I tested common biomarkers that those of us in metabolic health practice often test, and also tested him with scores on the Parkinson's Anxiety Scale, the CESDR Depression Scale, and the UPDRS, which is a commonly used Parkinson's symptom scale. I calculated his baseline cardiac risk ratio, which took his triglycerides divided by HDL. The ketogenic approach involved a well-formulated ketogenic diet with fats at 70%, proteins at 25%, and carbohydrates at 5%, according to daily calorie intake. I did boost his protein percentage. The reason this was is this individual had been bedridden for so long. He had significant sarcopenia and weakness, so I wanted to boost his protein intake for that reason. Of course, people with Parkinson's know that they need to time their medications, especially their levodopa, around their consumption of protein. The results of my case study included clinically significant results when baseline was compared with his 12-week results. We know that when we have our patients start a ketogenic diet, some of their most significant improvements are within the first 12 weeks. But I also saw positive improvements and trends towards significance, but not statistically significant, at 24 weeks in all variables. Biomarkers of health improved at 12 and 24 weeks. These included hemoglobin A1C, high sensitivity C-reactive protein, decreased at 12 weeks only. The subject reported that when he had his 24-week blood work done, he was suffering from a severe bronchial infection, which could have affected his hsCRP results at 24 weeks. His triglycerides, fasting insulin, weight, waist circumference, and cardiac risk all improved at 12 and 24 weeks. In addition, I saw improvements in his scores on the depression and anxiety scales at 12 and 24 weeks. This is a table that summarizes his results at baseline, 12 weeks, and 24 weeks. Just to highlight a few, you can see that his triglycerides dropped significantly, his HDL increased, his hemoglobin A1C decreased. His hsCRP, as you can see, did not decrease at the 24-week mark, but decreased at the 12-week mark. His weight decreased significantly. His cardiac risk decreased. And then the scores on his scales, you can see them: PAS, the CESDR, and the UPDRS parts 1 and 2. Part 1 of the UPDRS are the non-motor symptoms of Parkinson's, and Part 2 scores their motor symptoms for activities of daily living. My conclusion was, based on my findings on this case study, that the ketogenic diet is safe and effective for improving health biomarkers and symptoms of metabolic syndrome, depression, anxiety, and Parkinson's disease over 24 weeks. I will note that the first 12 weeks yield the largest and most statistically significant results, but there still were positive trends and improvements from the 12-week to 24-week period. I recognize that this is an N of 1 experiment. This is a case study, so future clinical trials are needed for more generalizable results. This is the reference to the published article, and I welcome you to go on the Journal of Metabolic Health website and review the full article. The article was published in April of 2024. Thank you for viewing my presentation and stopping by my research poster at the Society of Metabolic Health Practitioners Metabolic Summit in August of 2024.